right now, Catherine?
Off you go.
Right. Welcome, everybody. It's great to see a lot of people here today. I'm Heather Forsyth. I'm going to be your MC for today. Now I would like to do the acknowledgement of country. I would like to acknowledge the traditional owners of the different lands we are meeting on today and ask them to. I would like to say thank you to them for letting us gather on their land, and I would like to pay my respects to the elders past, present and the future. Now I'm going to give you some housekeeping. Before we get started, please keep your cameras and microphones turned off. This is helping the interpreters and the people who need them to see. You can, if you can pin the interpreters to the screen, you can do this by clicking the three dots in the right hand corner of the screen and click pin. The interpreters today are Chelsea and Megan. If you have any questions, you can turn your camera on and put your hand up, or use the chat function for comments and questions. We will have spotters to keep an eye on this. The webinar will finish at 4:30. This webinar will be recorded today. This will add the captions. A copy of the recording will be available in a few days on the Inclusion Australia web page in the news section. Also today we've got live captioning is available. If you need it, the link will be added to the chat. Thank you to the IT. Now for the overview, I'll just tell you a bit about the overview where it's going to happen today. We will hear from Catherine from Inclusion Australia. She's going to speak to us for about 10 to 15 minutes. She will give us an overview of the COVID-19 vaccination program rollout. We will hear, and she will take questions from you. Then we are going to hear from Bridget, from a representative from the Department of Health, who will answer your questions too. If you use the chat to comments to ask your questions, or you can turn your camera on and put your hand up. As I said earlier, we have a spotters to keep an eye on this. Now I would like to introduce Catherine from Inclusion Australia, the CEO, and Bridget from the Department of Health. Thank you for coming. Thank you, Catherine.
Thank you very much, Heather. I appreciate very much your warm welcome and the wonderful MC job that you're doing. I'd also like to acknowledge the traditional custodians on the land which we gather here today and pay my respects to their elders past, present and emerging. And I extend that respect to Aboriginal and Torres Strait Islander peoples in the briefing today. I'd also like to acknowledge self-advocates. acknowledge their work in speaking up for themselves and driving the changes that we see every day. And in particular, in this regard, the questions that they've asked us in terms of the vaccination rollout. So this webinar is about the COVID-19 vaccination program. It focuses on people with intellectual disability. So we're particularly going to look at the questions and issues that are relevant for people with intellectual disability. And we also will have a few more webinars later in the month run for and by people with intellectual disability. So if you'd like to participate in that, or you know that anyone that would like to participate in webinars, which will be smaller numbers and led by people with intellectual disability, if you could look at our e-news, we will advertise them on our e-news, and we will also advertise them on social media. Hopefully you've all got a copy of the materials that we emailed last night, I think, or early today, connected to the webinar. We're not showing a PowerPoint on the screen because we are using interpreters, and it's important that people can pin the interpreter to the screen. But when I'm talking, I will be following basically the layout of the presentation that you've been sent. So if you've got it printed up or on your screen, you might like to refer to it. I'm also happy for you to ask questions in the chat as I go. I will answer the questions that we know the answers to that have been published. And if I don't know the answers, I'll say that we will have to make that question wait till later when Bridget from the Department of Health will answer the questions that might be a little bit more complex. One of the things we did want to make clear is that the Department of Health website is the source of truth. So all information about the website, about the COVID-19 the COVID-19 vaccination rollout, the source of truth is the Department of Health website. So if you're not sure, that's the most important link to have. However, there are so many links and so much information that we have tried to put the connections through to the specific pages in the information that we have sent you. So I particularly recommend that you sign up for the updates, which you can do at health.gov.au/COVID-19-vaccines. So about COVID-19. We have lived in the pandemic for nearly a year now, and we all know about the disruption, particularly if you're from Victoria, to our lives. We know that COVID-19 is everywhere. We know that it is serious because it spreads easily and quickly. And we know it can cause severe illness and death. Now, in Australia, it's been pretty well managed. We've shut the borders, and we've done lots of local things like social distancing, hand washing, wearing masks, and we've had lockdowns from time to time to make sure that we can get rid of COVID-19 when it has got into the community a bit. Now, the vaccination is another layer of protection for us all. You'll notice that the recent outbreaks have been largely related to international travellers and quarantine. Now, Australia needs to open up. It's going to need to bring more people home and open up maybe for trade. And so it's possible that other outbreaks could occur. And so that's why the Australian government is bringing in the vaccination. So the vaccination program will help stop the spread of COVID-19. It'll help make people who get COVID less sick. It's being offered free to all Australians, and vaccination is voluntary. No one can be forced to get vaccinated. Everyone has the choice on whether or not they want to get vaccinated. But because not everyone can get vaccinated at the same time, the government has put in a system where the people with the highest priority will get the vaccine first. And that's based on risk. And it's based on two risks. One is the risk of getting COVID because of your job or because of where you live. And the other risk is if you might experience a severe outcome because of underlying health conditions. And one of the reasons that we're having this webinar is because there's new research that shows that having an intellectual disability can be a significant risk factor. And so we think it's really important that people with intellectual disability and their families really understand what there is to know about this. Now, there's a government group called, the acronym is ATAGI, and that stands for the Australian Technical Advisory Group for Immunisation. And they're the group that provided the advice to government on how the prioritisation should occur. And ATAGI is made up of people such as doctors, epidemiologists, that's a word we didn't know much in the past, but we've heard lots of now, nurses and researchers. And they've come up with 4 phases for the vaccination program. And the 4 phases are called 1A, 1B, 2A, and 2B. And they've identified the groups of people in the Australian population who are going to be who will get the vaccination first because of the risks that I just mentioned, that they might get it through their job or they have an underlying health condition that means that they might need it. So phase 1A has started. Thousands of vaccines have been given, so mainly to people working in healthcare, at COVID testing stations, and at aged and disability residential settings. So what that means for people with disability is anyone, if there are young people in nursing homes, that will include them, and will also include people in group homes with 2 or more people with disability living there. Now, the important thing to understand about phase 1A that's different to everything else is it's what they call the vaccination comes to you. So what that means is if you live in a residential setting, such as a group home, the vaccination will come to you. It will be organised through your service provider and the vaccination will come to your house. What's different about everything else is that we, as the members of the community, will need to go to where the vaccination is. And that could be in a few different spots, and we'll talk about that in a minute. But one of the things to remember is if you are entitled to get the vaccination in Group 1A, if you're in a residential setting like a group home, and you decide that you're not sure about it, or maybe you're not feeling well on the day, and you don't have the vaccination, you can get it again later. So you can change your mind and get it again later, but you will have to go to one of the places where the vaccination is, to a doctor's clinic or one of the places where the vaccinations are given out. The people won't come back to your group home another time. They'll only come twice, once for the first jab and once for the second jab. Now, phase 2 is likely to start at the end of March, although the actual date has not been released. And it's one of the reasons why Bridget is here today, because things are moving very fast and the government's trying to get organised very quickly. And the vaccinations are coming, some of them are coming from overseas and some of them are being made in Australia. And so they have to sort of keep making decisions while these changes keep happening. So phase 1B is for people aged 70 years and older. Aboriginal and Torres Strait Islander people aged 55 years and older, people who work in defence, police, fire, emergency services and meat processing, noting that you will have to prove where you work to get the vaccination. And there's also a list on the information we've given you a list of some of the underlying medical conditions. And there's also some information about what you need to provide for proof. Now, our page 5, I think, tells you some of this information and tells you the sort of evidence you can provide. So it might be your clinic records at your GP, it might be a referral from a GP, it might be a declaration form. So there's a number of different ways that you can prove your eligibility. And I would note that the Department of Health have been gradually adding more details about who's eligible in Group 1B. So, for example, in the last few days, we know that people with Down syndrome are eligible specifically. We know that people who've had a stroke are now eligible. And there's a lot of other things to do with underlying medical conditions. And if you're not sure, you can talk to someone that you trust, or you could talk to your doctor to check whether or not whether you're eligible to get a vaccination in stage 1B. Now, phase 1B also includes essential carers, which might be family members, volunteers, or paid carers, and proof is required. Now, I'm a little bit unsure of this point because it might not include all the family members of someone who, someone in the family might qualify for stage 1B. I'm not quite sure how many of the other family members might be done. So we might ask Bridget to answer that question when we get to the questions in a few minutes. Also support people who volunteer in any of the settings. Anyone who volunteers in the setting, so such people that volunteer in group homes, or people that volunteer in residential settings, or people that volunteer maybe in hospitals, might also are also eligible to get 1B. And also people that get supports in centre-based settings. Sarah, I'll come back to your question in a minute. Oh, actually, I can answer your question now. I'm good, thank you. It's good to see you. I just want to let you know that the people who are eligible for 1B will not be contacted by their doctors and stuff quite yet. We probably will have to wait another couple of weeks before the people for 1B will get contacted by their doctors. Mainly people in 1A, because they're still rolling out 1A, they're still getting all the people in the residential settings first. And then if we haven't heard after that, then we can start getting worried. Now notice that, and so then we go to stage, so that's stage 1A, then 1B, remembering that everyone will get 2 injections. You get the first one and then a few weeks go past and then you'll need to get a second injection to make it work properly. So phase 2A is for people aged between 50 and 69 years, and Aboriginal and Torres Strait Islanders aged between 18 and 54 years, and other critical and high risk workers. Now, it's sort of weird, but the phases might overlap a little bit. So while they're still finishing off like 1A, they might start 1B, and that's because of geography. That'll be worked out as to how things can get to what places, because the government's trying to move the vaccinations into the community as fast as they can. And then phase 2B is for everyone else, so people without underlying conditions or risky jobs who are aged between 18 and 50. And as I mentioned earlier, you can also go, if you decided not to get the vaccine earlier, or there was a reason you couldn't get the vaccine earlier and now you can, you'll be able to get picked up in that last stage of 2B, that you'll be able to get the vaccination then, even though you could have got it earlier but you didn't. So there are 2 vaccines that have been approved. One's from a company called Pfizer and one's from a company called AstraZeneca. And when they do the approvals, they do trials and testing. They also have to test each batch of the vaccine to test for their safety and effectiveness to make sure that they work. Now, I mentioned that both of the types of vaccines need 2 jabs a few weeks apart. And lots of people have asked about if you also get the flu shot. And generally, it's recommended that there's a 2-week gap between getting the COVID jab and the flu shot. And we've listed some websites where you can get information. It's on about our page 9. There's information about symptoms and side effects, and you can also get information about vaccine ingredients if that's something that you want to know more about. Now, one of the things that is going to happen is the government's very keen to keep the records of who gets immunised. And because they also need to monitor what percentage of the population's been immunised, because then they've got an idea of how safe the community is. So it's going to be recorded on the Australian Immunisation Register, and people will be able to check their own vaccination records. Now, there's also a website to check about information for people who should consult a doctor before getting a vaccine, because some people might not be able to have a vaccine if they've had bad reactions to vaccines before, or if they've got particular conditions, or they might need extra care. And so if you're not certain, or if you know that you've got some health issues, it's really important to talk to a doctor or someone you trust to make sure it's safe for you to get the vaccine. One of the other issues is that it's important that people consent to having the vaccine. So it's really important. It's really important that you do consent to having the vaccine, and that people are not forced to have the vaccine. So even if you've got if you're a legal guardian or decision maker, and you must be the legal guardian or decision maker, not a family member that assumes that you've got guardianship, and you consent on behalf of a named person, if the person themselves on the day of the injection makes it very clear they don't want to have it, they must not be held down and given it. They must not be forced to have it. It's important that everyone consents to have it. So there's a few different consent forms and different ways that you can consent, and some of them can contain information about the appointment as well. And when you consent, generally you say that you understand, you've been given information on the vaccination and that you understand it, that you don't have an underlying condition that might make it unsafe for you to have the vaccination, or you have talked to the people giving the vaccination or your doctor about your underlying condition, and that you understand that you will have to have 2 doses. So one on the day and then another one later on. And there's information on page 11 and 12. We've given some, section 6, page 11 and 12. We've given some links into understanding about the consent procedures and the forms that you will have to fill in about consent. There's also links to the various state and territory guardianship or public trustees at the very back of the pack. So in the last couple of pages, we've got links through to public guardians and public advocates, public trustees, who also might have information about consent. Now, I wanted to let you know that our Tasmanian member Speak Out is developing a decision tool to assist people with disability to decide whether or not they want the vaccine. So this will be in animation form and it will be in easy read, and so we hope that it'll be really helpful, and we suggest that people keep an eye on our e-news or our social media for when this is completed and available online. When it is available online, it will be accessible through the Inclusion Australia website and also the Advocate website. Wanted to just give a shout out to the Advocate website, because that's the website run by Dana, Disability Advocacy Network Australia, and Inclusion Australia for information, plain language information about COVID. And it's particularly got information for advocates and people with disability and family members. And so that's a really good place to get information for people about any concerns you might have for people with intellectual disability. And I've mentioned the Health Department website a few times and the various other websites that are available. And also note that when you want to understand about, when you're looking for information about the locations within your state as to where the vaccination might be available, you'll also need to keep updated with the Department of Health website, and Advocate will also keep up to date as well. When the places that you will get the vaccinations become available, the government has confirmed that the location should be physically accessible and also have the information about the COVID-19 vaccinations in accessible formats. Now, some people have asked about home visits, and there will be some information about that available later this year. Again, Bridget might be able to tell us a little bit more about that. Now, yes, so our Riley in our tech support today has put the link to the Advocate website and the Inclusion Australia website in the link if you would like to sign up to those e-newses, because that will tell you when there's new information on the website. At this point, I think I might pass over to Bridget from the Department of Health to answer questions, and we'd invite people to put questions into the chat and or turn on your microphone and video and ask a question, just remembering that we are recording this session, so if you don't want to appear on video, then maybe you'd like to do it during the chat. And Sarah, you've sent me a couple of questions through the personal messaging. Would you like to start off with asking your questions to Bridget, or are they personal and would you rather do them at some other time with an advocate?
I'm happy to ask Bridget if it's okay.
Sure.
Hi, Bridget.
So Bridget's just, hang on, they're just going to turn on her. It says Simon on the form, but Bridget's there as well.
Yeah, Simon's phone, but Bridget, and you can see Maddie in the corner too. Hi, how are you?
Hi, Bridget, Maddie, good. How are you? I've sent in a referral already to Westmead Hospital from a GP who has confirmed that I am a high priority due to my medical condition as I suffer from epilepsy. He said that I should be prioritised for a COVID-19 vaccine. However, Westmead Hospital have not contacted me to acknowledge that they have received the referral to let me know whether the information is sufficient or if they need more information in the referral from a GP and I need to go back to the GP and to get more information from them or another GP and then resend the form. How do I know if my referral has been received and accepted? And if I need anything further to provide from the GP with in-depth information to say I have epilepsy, then therefore that's my medical condition, and therefore I'm a high priority to get vaccinated under phase 1B. And then whether Westmead Hospital then contacts me and lets me know for appointment dates and times, or me ringing up them as if you would, just like you would contact your advocate if you were wanting help.
Hi, Sarah. Thanks very much for the question. When we get to phase 1B, because you will be a priority in phase 1B, there will be a booking system and you can book in either with your normal GP or there'll be vaccination clinics that you can book in with. And at that time, you'll be able to get the vaccine. So you don't have to worry for what Westmead Hospital says. You can just go to your normal GP when he or she is ready to start the vaccine process.
They're not approved to administer the vaccine. Their application was rejected.
Oh, they must be one of the very small number of GPs that are not doing it. There will be a booking system online. So if you go to the eligibility checker on the Health Direct website, and I'm sure Catherine can circulate this information for everybody after the webinar, there's an eligibility checker. And when you go through that, when that phase 1B starts, that will take you through to a booking system where you can find a GP clinic or a vaccination clinic close to you, and you can book in to go.
So, Sarah, just checking that you understand that what Bridget's saying is that at the moment you can't book in for 1B, but when 1B starts, the eligibility checker that's online will include a link to a booking system and you'll be able to book then. So we can't, if you're eligible for 1B, it hasn't started yet, they're still doing 1A, but when 1B comes in, you'll be able to book in then. So does that make you feel more comfortable?
Yeah, feel more comfortable. It's not the booking system, Bridget, Maddie and Catherine, at the moment that's my worry. My more concern is how do I know if Westmead Hospital is accepting the referral that I've already sent in and whether it's sufficient or not? That's my main concern, because in the information that was given to me, I was told that what I needed to prove my medical condition was you either needed to prove it via my health record, a health professional referral, or a declaration form. So my main concern at the moment is whether the information I've put into Westmead from a GP is sufficient enough that they accept it, or whether they need something that's more like a half a page document or a 1-page document. That's my main concern at the moment, not so much booking to book appointment dates and times.
Okay. Thanks, Sarah. I understand your concern. Westmead Hospital may not get back to you because you will need that evidence from your GP at the time when you go to have a vaccine, and that's not likely to be at Westmead Hospital. So I don't think you need to be concerned about Westmead Hospital. You just need to take, if your GP has said you're eligible, you just take that into the vaccine provider when you've got a booking, and that should be fine. If your GP has said, we just trust in GPs, and if GPs say that you're eligible, then that's okay. That will be enough.
Yes.
Is that okay?
Is that okay?
Yep. And they should put that on my file anyway, the referral anyway, I would think.
I would
That's
think
right.
so. But
Yep.
but they won't. But they probably won't reply to you because it's still too early to know where you'll get your vaccination, and you can just take the referral from the doctor to the place where you get your vaccination, and they will accept it because a doctor's signed it. That's what Bridget's saying. The health system trusts doctors, and if the doctor has signed it, the answer will be yes, you can have the vaccination.
That's right.
So if I go down to Westmead on the day when they do say yes, that everything's open, and I say to the person I've already handed in my referral, they will see all that.
No, you'll need to take your referral on the day.
Well, I'm not going to take it on the day because I've already gone into the work to send it in to them already.
No, I think what Bridget's trying to say to you is it might not be Westmead where you get the vaccination. That might not be the place.
Because I'm going
there might
for
be
Pfizer,
somewhere.
Because I'm going for Pfizer, and Westmead's the only one near me other than Royal Prince Alfred, from what I know, is offering.
Okay. Well, I think we're going to need to check if anyone else has got questions here. But if you're still concerned about it, it might be good. You can talk to your advocate about that too, because I think you get advocacy support. You know where to get advocacy support, Sarah?
I don't really need the advocate's help for this. It's more finding out all the information on this. This is what Yvette from CID suggested to me to
Excellent.
join.
Excellent. That's good. Does anyone else have any questions that they'd like to either turn on their microphone, take themselves off mute and ask a question, or put it into the chat? And while we're waiting for that, Bridget, I was just wondering if you could explain a bit further from the question I asked about family members, because it's not quite clear on the information about which family members of a person who might be in 1B are eligible and which ones aren't.
Thanks, Catherine. Yep, I understand what you mean. As far as family members go, it's family members who are caring for a person with disability who is eligible for phase 1A. So it's about making sure when people come together in settings where there's two or more people and there's more chance of risk, that the carers who can be family members are eligible for when they're caring for a family member in that setting. So not all family members are eligible. So you can't, if you're lucky enough to have 8 brothers and sisters and they all help look after you, they won't all be getting the vaccine at that time. But it would be your mum or your dad or your big brother or sister who's the main family member who cares for you would be eligible for the vaccine at that time.
So even if they all live in the same house, it would still be the primary carer who's likely to be one of the parents or someone
Yes.
else who's eligible.
That's right. So the primary carer.
And is that done through, how is that proven? Is that through the carer, a recipient of the carer allowance or something like that? Or is that just nominated through the doctor? How do you prove that you're the primary carer?
There's a couple of ways that you can prove that. There is the carer allowance. There's a form that you can fill out that just says, I am the primary carer. And what else is there? There was one other thing too. There's 2 different types of carer support. There's the care allowance and there's...
the carer payment, yeah.
Yes, that's it. So if you've got that, but if people are really worried, there is a form that they can fill out and it's just a declaration that says that I am a carer and that I'm eligible, and the GP will be able to accept that. And if you are going to your regular GP, it's very likely that the GP knows your family and knows your circumstances, and that will be fine.
Right. So there's a question from Rebecca in the chat saying that often for people with, so children, for instance, with high disability support needs, really both parents are primary carers, but Centrelink only allows one to receive the allowances. But the reality in the home is that you've got 2 people sharing the care fairly equally, particularly of a child. And so the question is, what would happen in that situation? Is the second carer eligible as well?
At this stage, we are talking about the primary carer, but I think that's a conversation that you could have with your GP who understands your family circumstances. And I think that would be very reasonable.
Right. So there's a little bit of, again, when you say you trust the doctors, what you're saying is that when doctors understand that there's slightly complex circumstances, that the doctors can take that into consideration?
As the vaccine rolls out and more people there's more and more vaccines available and more people in the community are getting access to the vaccine, I think that's what we will see. At the moment, we're just going for very high risks at the very beginning because there's not a lot of vaccine in the country, and we want to reduce the risk of people who'll get really sick if they get COVID-19.
Does anyone else have a question? I'll just go quiet for a minute in case someone wants to turn on their microphone and video and ask a question directly.
So we've got another question in the chat.
There is another question in the chat, Heather, from another Heather. The question.
Do you want me to read
yes,
it?
are you there, Heather? Yes,
yeah.
Heather Renton. Yes, if you'd like to speak to that, that would be great.
Yeah, sorry. Oh, hang on, just lost you. We've got families who've got kids with undiagnosed and rare genetic conditions. They also have a disability. I can't find it in the information. Do they qualify in, the early stage 1A? You talk about what's the wording on the document? Sorry. Oh yeah, younger adults with underlying medical conditions, but you don't actually mention children. So when do they fall in?
At this stage, children under the age of 18 are not eligible to receive vaccinations in Australia. There's more research being done, and as soon as the governments and the TGA, which is the Therapeutic Goods Association, are confident that we can be vaccinating children under 18 years of age, then we will.
Okay, but both parents could be on the doctor's discretion if they're carers?
Only if the child is over 18 years old.
Okay, so if you've got a 14-year-old, the parents don't qualify for 1B either. You've got to have the
Not
kid
to the
over
best of my
18.
knowledge. I'm happy to take, if Catherine's okay, I'm happy to take that question and find out the exact answer. But
That would be great.
because I think my understanding is they would not be eligible, but let me check that because I'd like to get it right for you.
Okay, so you'll let Catherine know and she can just email me the answer, because I think a lot of the genetic peer support groups would be interested in the same question. So
fair
that'd
enough
be
too.
fantastic. Thanks so much.
Thanks.
And in fact, there's a question in the chat, and I've seen this too. Some places they've referred to children under 18, but there's a couple of documents that talk about 16. So there seems to be some grey areas around people that are 16 and 17 years old. Could you shed any light on that, Bridget?
We're saying children under the age of 18. There was some, with the different types of vaccine, there was some uncertainty at the beginning whether it was 16 or 18. So just for clarity, I'm just sticking with 18 because that I know is definite. Yeah. I think, you know, as more research happens around the world and we get more information, things have changed. So apologies when sometimes, but on our, the Australian government national rollout strategy, it does say 18.
Yes, and I think it's one of the reasons why we encourage people to stay connected to the health updates or, you know, to advocate, because things are changing and the government might change the rules if more information comes to light or more research or more tests have been completed. It's always possible that there will be changes to how that's run.
And I think, Catherine, that's very important for the underlying medical conditions. As more people provide us with evidence, as you yourself and your organisation have done, then we send it to the experts and they do consider it and make changes. And you've seen that yourself. So it's important that people do let us know, because we can't always consider all of the situations.
And there's someone that wasn't able to come today that did send me a question in advance, and this is won't be an absolute surprise to you, Bridget, have asked the question about sedation, so not talking about people that need a general anaesthetic who might need to go to a hospital setting, but for people who need sedation to have a vaccination, who choose, you know, will give consent to the vaccination, but will want sedation in the process, is how will that be managed? I know there was some talk of specialist clinics, but it would be great to hear from you how that will be managed.
Yes, at this stage, we're not anticipating that there will be specialist clinics. It's likely that those arrangements will have to be made through that person's regular GP. We think that, you know, in Australia, we talk a lot about how important it is to have a regular GP and have regular healthcare and be working with somebody who really knows you and your medical condition. So with vaccination as well, we think it's very important to be talking to your regular GP.
So, of course, the only thing we would say there is that there are some people with intellectual disabilities who don't have informal supports and who may not have a regular GP, but they will be in particular circumstances, and it's likely that an advocacy organisation would contact you in that regard.
Okay.
Yes, there's still a little bit of discussion in the chat, particularly for people with particularly about people with rare conditions, about concerns that, again, about the primary carer, if there's only one carer gets vaccinated and, you know, the carer falls ill or whatever, that does leave a family vulnerable. And so I suppose you can just reiterate what you said about talking to your local doctor about those situations.
And also, not getting the vaccine does not increase your chances of getting COVID. Getting the vaccine decreases your chances of getting COVID, but, you know, it's not like if you have to wait a bit longer, you're going to be at any greater risk than you were before.
Sarah's asked a tricky question in the chat, which I've heard you answer in other places, but asking about the the different vaccines. So is there a vaccine that's has a higher percentage effective rate? Do you have suggestions or recommendations on which vaccine is most suitable for people with medical conditions, and why? And there's a separate question: why is the AstraZeneca vaccine have a different space apart of the? I don't know if that's right. Is there a different space in terms of the two vaccinations you have with AstraZeneca and the Pfizer one?
Okay, Catherine, I would say to this, I'm not a medical practitioner. So I think when answering these questions, basically, the Australian government uses the TGA to approve the vaccines. They're approved and that means they're safe in the Australian community. They've approved two types of vaccines, so they think that they're both effective. And there's been no evidence yet that one of the two types of vaccines is better for people with any sort of disability. So for people with rare conditions, talk to your regular GP, because you can't categorically always say that a medication is going to be safe for everybody or a vaccination is going to be safe for everyone. So I think for those absolutely detailed questions, it's best to go to the GP.
Did anyone else have any questions they would like to ask? Again, invite you to turn off your microphone and turn on your video, or put it in the chat.
One from Marie on here.
Are you talking about when Marie was talking? Yes, I think we mentioned that about if a primary carer becomes ill and there's no one to care for a child who might have a life-threatening rare condition. That was the one that Bridget said that the people could talk to their doctors about, that if doctors are aware of the family situation and you have a regular GP, that they might use some discretion in that situation.
There is another comment. Sorry, Catherine.
Oh, is there? It looks like I have met. Oh, it looks like I've met one. Oh, I have got one. I've missed that. Bridget, have you got any of the latest information on when 1B might start? I did say in my blurb late in the month, but I don't know whether you've got any hot off the press information you can help us with.
At this stage, we are aiming for 22 March for 1B to commence. So 1A will keep going along once 1B has started. And when there are enough vaccines produced in the country, then 2A will start while 1B is still going as well. It's all about making sure there's enough vaccines available to go through the priority groups in Australia.
Do you... how will we know that our, just to go to Sarah's question, how do we know that our own GP is a deliverer of the vaccine? Like, is it up to us as health consumers to actively contact GPs, or will GPs reach out to us? Like, particularly if we've got a family member who's eligible for 1B, how do we know when our turn in the queue might come, and that we should go from there?
We know that some GPs are actively reaching out to their regular patients who they know are eligible, but we also know that some GPs are going to rely on their patients to come to them. I think it's something like 95% of the GPs in Australia have put their hand up to administer the vaccination. So once, as I said, there's enough supply in the country and it gets out to all the GPs, I think the vast majority of GPs will be able to give you a vaccination. Yeah. You can also, when you go onto the eligibility checker, for people who don't have a regular GP or want to find out if their GP is on the list, you can go onto the eligibility checker on the Health Direct website. When you go through that and it says you're eligible, as soon as 1B opens up, that will take you to what we call the service finder, which is where you can see whether your GP is on there or not.
Is there any way of finding the GP finder or the booking system directly on the health website? Will they have direct links, or do you always have to go through the checker to get to those links? So particularly once we've, like a lot of us have been on the checker and already used it, so it'd be quite useful to be able to go straight to a link to the booking system or the
At this stage, I think it is through the eligibility checker, but I'm not sure whether it'll always be that. But for the initial, once 1B starts later on in the month, it'll be through the checker.
Right. So that's a new piece of news as far as I'm concerned, that it means that we should keep going into the eligibility checker because that information might be updated. Is that what you're saying?
Information is being updated on the eligibility checker, like information we spoke about more information about underlying medical conditions. That sort of thing will be updated. But I think you can wait until you've heard that 1B has started and then go on to the eligibility checker, and then you can find out if there's a GP or a clinic near your home.
That's great. Now, what happens with workers who have a lot of contact with people with people with disability, or there are some workforces that are in multiple settings, so they might be in might be a service provider who provides support into group homes or into day services or into individual homes, but is not an employee of one of those big places. You and I were on a call recently where they were asking about labour hire firms and others.
Yeah.
What sort of evidence do the employees need to say that they work in those settings and that they might come under, in particular, Phase 1B?
They can just provide pay slips or evidence from their employer, but they'll also be able to fill out a declaration if need be, because it's about the risk and the community and the people that you're working with that makes you eligible. It's not about who you work for. So I think that, as always, people receive pay slips. They could take a screenshot of pay slip of pay slip, or even payments going into their bank account. That would be sufficient.
Right. Yep.
Catherine, can I ask a question? Sorry, it's Rebecca.
Hi, Rebecca. Yes, absolutely.
Hi.
Just the age, sorry, I work in the sector and I've got some clients. The age, if we've got some clients who have very low, quite low immune systems, and their doctors have been talking about them getting on as soon as possible, but they might be a few months off 18. So I know before you said the new evidence is 18. Are those people still eligible for 1B if their doctors are saying that they should be getting it as soon as possible?
I'm not able to answer a question like that because I'm not a medical practitioner. I think that at the moment, same with everything in Australia, if the cut-off is 18, we cut it off at 18, even if you're 2 months before that. But I do understand what you're saying, and I would, again, encourage them to be talking to their GP, and I'm sure their GP can sort that out for them.
There's, I suppose the other question is about people, the question I just asked about workforce in 1B, does that also apply for workforce in 1A?
Yes.
If you're in a workforce that you're not employed by the residential setting, but you're in and out, it's the same for 1A, 1B. You just need to have your proof of your role, your job.
That's right. That's right. And so what's very likely to happen for that workforce is the people who are working on the day.
Sorry, Rebecca, did you? That's right, keep going, Bridget. Yep.
Sorry. So the people who are working on the day that the vaccine teams come in, they will get their vaccine at that time, as well as the residents. And the other workers who go into that house they'll be setting up clinics around that they can go at their leisure and get the vaccination in a clinic. There's not an expectation, because people work in so many different places, and some people are part-time and some people have other jobs. So it's not like that's their one chance, is they have to get there on the day the vaccine team comes. But what I will say though is we have started the rollout, but we are starting to ring around to eligible people for 1A, which is when the vaccine provider comes in. So people will be starting to get those, or service providers and private residences will starting to get those phone calls in the next week or two. And then it probably will be another couple of weeks, maybe a month, before then you get another phone call about scheduling in the vaccination. So I'd like to send a message not to panic if you haven't heard from us, in the next couple of weeks. You will hear from us in the next couple of weeks to ask about how many people live in the house, and make sure the address is correct and the key contact person is correct, and how many people who are working there will be working on the day. But then it may take a bit more time for us to get around to all of the places around Australia, because there's a lot of places that we have to get to all around Australia.
And there's one more question in the chat, and I think this will need to be our last one because we do want to finish on time. And that's about eligibility of carers. At the moment, it doesn't seem like the eligibility checker scoops up carers in the eligibility. It only scoops up people with disability. Is that?
Yep.
Are you expecting that to be updated?
We are expecting it to be updated. Yes, that decision was only clarified this week, and there's still some more work going on around making sure that the words around that are very clear. Once we've got that all sorted out, it'll go up on the website.
Yes, I know sometimes in the rush of getting the information out, you get it out and then you realise it's not quite clear.
That's right. That's happened a few times.
Yes, which is hence we emailed you on a semi-regular basis. What does this mean? So that's
right.
That's really great. No, I really want to thank you for attending today and being able to answer the questions, particularly from people with disability, intellectual disability, and their families in particular. Most of the people who have spoken to you are people with intellectual disability, family members, and organisations that support them. So that's great. And I'd just like to pass back to my Heather, who's the chair of Our Voice, just for some closing remarks.
Thank you very much. We really appreciate the invitation. Thanks.
Thank you, Catherine. So thank everyone. Thank you for your coming today. We appreciate your time and your questions. I would like to thank Catherine and Bridget for doing the presentation. And finally, I want to remind you that the webinar was recorded today. We will be adding captions, and a copy will be available in the next few days on the Inclusion Australia website in our news area. Thank you for coming.
Thanks, everyone. Have a good day.
Have a good day, Catherine.
Thanks, Sarah.